Hi, my name is Tiffany Richardson. I'm an implementation specialist with Revell. Today I'm going to review some of the options for documenting immunizations. So oftentimes we have this option where we want to do a flu clinic, for instance. So you can create a resource schedule and call it flu clinic, so that way that all the appointments that you're setting up are going to go to that resource schedule for the flu clinic, depending on how you want that to populate. So one option to do that is to go to Menu, go to EMR, go to Immunizations and Therapeutic Injections, and then go to Immunization Templates. When you open the Immunization Templates window, you have the option to create a new clinic. When you create a new clinic, this also works in two ways. This will create an immunization favorite if you want to work from your progress note. If the patient's already scheduled on the schedule for another visit, and you just want to document the flu immunization, there is ability to make that as a favorite. So in your right chart panel under your templates, if this was made as a favorite, you would see that, and we'll demonstrate that shortly. You can name the name of your flu clinic. Often I recommend that you name it with the initials of the staff member who's going to be doing this flu clinic or using this template. But you do have the option to leave the given by who is the user, the staff member that may be given that immunization. You can leave that blank so that may be filled in by any staff member. You are required to put a provider's information here. So you would select whoever that provider that would be getting the claim paid for. You would mark the visit type. So if you had a visit type that was called flu clinic, you could label it that, or however you want to label it. You have resources, and if you had that flu clinic saved as a resource, you could actually just select that, and then it would put it on that resource schedule without busying up the provider's schedule for a flu clinic visit. I'm just going to go ahead and put it under the provider schedule for this demonstration. For the visit status, this is a really nice piece because you can check out a patient. So whenever that you document that the patient has received their flu injection, it's automatically going to mark that patient as checkout. And I'll show you some other tips on the office visit window and locking those encounters. You want to mark your facility, whichever facility that's going to be associated to that flu clinic. And then you can mark some reason, and oftentimes it's just immunization, injection, or flu immunization, something just to indicate what that reason for that visit was. The next section you want to go to is the immunization and selection of that immunization. So I'm going to click the three-dot ellipsis here next to the right of the immunization name. And then you can select the immunization. So I'm going to select Flu Zone HD, is the one we have in our demonstration here. And then you can mark the lot number. Our flu is also allocated to our lot number. So when we mark our flu, it automatically is going to show us that immunization. If you don't see it in your system like that, that indicates that probably it's not set up properly and you're not able to identify that a little bit easier. But I also have this option here, display lots for selected vaccine only. So only the Flu Zone HD, I'm only seeing those lots that are specific to that medication. So I'm going to select that, mark done. So since I marked this, and this was all set up in the lot set up for immunizations for this Flu Zone HD, it automatically went ahead and marked the dose, the manufacturer, the expiry date, and that the route was intramuscular, because that was all set up in that setup, the lot number. The location, obviously, we're not going to know where by template where that location is going to be unless we know that we're going to give all of our patients their injection on their left bicep. But yeah, probably not going to do that for every patient. So we're just going to leave that blank. And if you are the one that is setting it up for yourself, you can go ahead and mark me, and that's going to, when you document this immunization is given, it's automatically going to not document the person that is set up in the given by aspect. I would go ahead and mark decrement the dose, and mark as billable, and mark as counseling. And I also want to mention about the counseling. When you're doing anything that has component style medications, like your HPV, IPV that have TB, not TB, excuse me, tetanus, DTaP, all of those that have multiple components of medications in there. If you have that set up, it will not drop the additional billing units without the counseling selected. So you always want to be sure that you're selecting that counseling, especially if you're doing your component medications and obviously you want to make sure that you're actually counseling the patient on these components of the medication, of the immunization they're getting. The VFC, it has to do with the the child vaccination piece as well. You have up here, I had mentioned the favorites with the plus sign. Right now it's not listed as a favorite because it doesn't have the plus. It's still indicating the green, meaning that it hasn't been saved as a favorite. If I go ahead and select it, it changes to a star with a red X, and that means that it is now listed as one of my favorites. So it's kind of misconceiving there, but if it is a X, red X on your star, that means that it is listed as one of your favorites. You also have show eClinicalWorks. So if there's any forms that the patient needs to sign, you could go ahead and set up that eClinicalWorks so that they can sign those patient forms. I already have one of these saved, so I'm not going to save this one, but I'm going to show you how it works. So when I'm in the flu clinic window, so say I already set this up, patient comes in, they come in just for a flu immunization. So what I'm going to do is I'm going to go to menu, I'm going to go to EMR, I'm going to go to immunizations and therapeutic injections, and then I'm going to go to immunization templates. But I'm going to tell you another little tip here. If you make this a star, highlighted here, you can make that as a favorite. And if you're working in 11E, when you're working with your favorites, you can either select your favorite and it's going to display here, or you can click on this arrow right next to the three horizontal lines here, and it's only going to display your favorites so that you can navigate easily around the system without having to go back to multiple clicks trying to locate that area. We could also type in templates here, and that would help us identify where that section is as well. So once I'm getting ready to do flu clinic, I just select immunization templates. I see my flu clinic. I click on my flu clinic itself. And when I open my flu clinic, it's going to ask me what's my patient's name. So I'm going to document my patient's name, identify which one it is. And now I have all of the pre-filled information. And of course, I had mentioned before, we don't know the location until we actually are about to administer the medication. So we would then select that. It is already marked as administered because that was set up in our template. Our lot number, everything is already set up. If a reason was set up, it would be documented here as well. The vaccination information sheet, whatever that date is, you can mark that so that it'll identify that information. If a VFC, if they're eligible, not eligible. And then as well, the decrement, the dose, billable, and counseling automatically by default selected. So now, as you can see, the only thing on here that I did was mark left deltoid. That's it. Everything else in this has been already filled out for me. Then I would just hit save and close, and it would be done. Or if I had another patient that I was giving a flu shot to, I would select save and select next patient, and that would then bring me into a new search window to then document that medication as given. I'm going to go ahead and mark save and close, and so that way you can see on the schedule and the office visit window how that appears. So as I'd mentioned, I obviously have another patient with this name on the schedule, but you know that this one is specific because it has the reason is the flu shot, because that's the way the reason was set up in the template. And as I'd mentioned, it's already marked check out, so you don't have to actually check this patient out. And you don't even have to actually enter this chart. This chart is completely finished at this point. So at this point, you could actually just, if you had the resource schedule set by all of those that were flu shots, you would be able to go here to select all the encounters that are open for that flu shot. And then you could lock progress notes, and that would lock all of those flu shot encounters if you were automating claim creation. I'm going to go ahead and enter the chart so that you can see the documentation is there as administered and it's fully documented with all your CPT codes. So if I scroll down to the bottom, and you can see in the immunization, because my immunization is set up that the ICD-10 that would populate as a Z23, that automatically is going to be documented on the encounter. I can see in my immunizations that it was also administered, and the CPT codes are dropped appropriately as well. So that is one thing with the immunization templates. So another area that I mentioned is that you can also use that immunization templates within your progress note on the right chart panel. So if you go to your right chart panel and you select the templates icon, you'll have this additional section called Immunization Templates. This is broken in the 11E version in some data sets, and so it is broken in our data set. We are currently working on getting that fixed. But in the EXE, this does work appropriately and completely works fine. So in the older platform, you would be able to see that immunization if you had it saved as a favorite down here. But you are able to use it from here and then merge it into the note like you would a template. The only thing I do want to mention is if you do merge that immunization into your note from the right chart panel under the templates tab and from the immunization templates section, when you merge that in, it does not mark it as administered automatically. And of course, any of the information like the provider, the resource, all the stuff that was set up in that template will not apply because it's based on the encounter. So if that patient was scheduled to be seen by the provider and then they were able to get a flu shot that day, you could still use the template, but all the claim creation aspects of it are going to be based on the encounters notes already documented in the system. But you do still have to mark this as administered, so you would still have to go into the flu window and just change that to given. If you select me, it's going to mark it automatically as administered, or you could change that to administered. So that is immunization templates. Now I'm going to tell you another option that often I've found that people are not aware of regarding immunizations. So you can actually set up immunization favorites, or any kind of favorites for that matter. So when you go to your immunization window for today's immunizations, on the left column, you will have all of these immunizations, injectable medications, whatever that you're giving to the patient. You'll be able to see here on the left column. When these categories are selected, whatever lot is associated to them, when you click on the lot number, it is going to display any of those lots for the selected vaccine. So you don't have to go and try to find the lot that's active for that vaccine. But there's one other option on here, and it's the favorites. So you see in this system, there's a little favorites icon, show favorite vaccines, and now I have only those that I have listed as my favorites. This is an option that you can preset in your system so that you can only see those that are your favorites, so that you can help identify those common medications that you might give more often. In order to set this up, it's quite easy, but you do have to have the security permissions to do so. You have to have the permissions under security settings. We go to File and Security Settings, and it's called Configure Categories. Whoever is setting up their categories or is in charge of setting up these categories would need to have access to this section here in order to set that up. So if we go to Menu, EMR, Miscellaneous Configuration, Configure Categories. In your category options here, and just note that this is also for multiple areas within your progress notes. You have your HPI, ROS exam. So those categories on the left-hand side in those windows that you're viewing in each one of those sections of the note, you can actually preset your category so you don't have to see all the extra information that may not be used by your system, because a lot of it was ECW generated data based on what might be beneficial to overwide practices. So if we go to our immunizations here, and then you have a list of all the immunizations in your clinic. You want to select whoever it is that you're wanting to give those favorites to, so you have all provider or all other staff. If you click on all other staff, you'll be able to select your staff member. Just make sure you select your staff member first, and then you mark whatever immunizations you want to save as their favorites. You can also copy those favorites. So say you're the administrator that manages all your immunizations and injections. You would have access to this window, or would request access to this window. You can go in there and preset it for yourself to kind of give yourself a blueprint of what maybe you would give to other individuals in your practice. And you can actually just select copy favorites. And when you select copy favorites, it's basically going to say, you're taking that individual's information, whatever they have saved as their preset favorites. So this individual that I have selected here, and then I would select copy favorites. And I can actually just go in here and select whatever section that I want to copy their favorites from. And I would select the clinic, and then I would select the staff member, and then I may save that, and that is going to basically overwrite all of my favorites onto this other user's favorites. But you see how easy that was to overwrite your favorites onto someone else's favorites or mess up somebody's favorites here as well. So we also want to make sure that the individual that has access to do this, it knows what they're doing so that it doesn't mess up somebody else's favorites or a provider's favorites that maybe they wouldn't be able to see the categories that they were accustomed to seeing. So that would be how you would set up those favorites. And that is why the display on the immunizations, you have your favorites in this window right here. The other option on giving immunizations, especially in pediatrics, this is pretty nice. But if you go to your immunizations window, whether it's immunizations here or if it's down here under immunizations on the immunizations link here, you have this immunization schedule. And if you have these set up in your system with the vaccinations that are already provided in your system, you could actually just go in and click and give that, or mark that you're going to give that medication if it's due. And that's another way where you can select add and you can give those medications if they're due already. And this is based on, this immunization schedule is preset by the system. So it has to be linked. You have to make sure you update your content distribution, and the CVX codes have to be associated appropriately. I've seen issues in the past where the immunization didn't register because the wrong CVX was associated to the immunization that was given. So those are 3 easy ways to help with flu or immunization administration. And thanks for attending.